Canadians diagnosed with a rare and deadly lung disease are sounding the alarm over a recent recommendation by the federal government. Patients being treated for pulmonary arterial hypertension say the proposal could limit their access to treatment by forcing doctors to take a one-size-fits-all approach. With more, we're joined by Tarya Laviolette. Thank you so much for being here. You are a PAH patient.
I am.
Over the phone, we are joined from Toronto by Dr. Sanjay Mehta, who specializes in treating the illness. Dr. Mehta, good afternoon to you.
Hi, Lee. Thanks very much for having us on.
Thank you very much for making time for us. Tarya, let's start with you. Tell me what PAH is.
So pulmonary arterial hypertension is a rare and potentially fatal disease. It has to do with the narrowing of the small arteries of the lungs. And Dr. Mehta can probably explain it a little better than I can, but I can give you the patient perspective. Basically what it means is shortness of breath. Patients often experience a difficulty with exercise, with even light activities. That's how I was diagnosed. I was just having difficulty pushing my son's stroller up a small incline or making the bed. And eventually, even just walking up a slight hill, I just had difficulty picking up my feet even. So it's a matter of the body not getting enough oxygen out, the heart not being able to get enough oxygen out to the rest of the body.
Doctor, how many Canadians suffer with this illness?
It's a great question, Lee, and we're not exactly sure. Our best guess is there's about 4,000 Canadians already diagnosed, and fortunately most of those people, like Tarya, are already treated for pulmonary hypertension, which is wonderful. We figure there's probably another 4,000 or so out there, so maybe a total of 10,000 Canadians could suffer from PAH.
When you treat them, how do you customize different treatments to suit each individual patient?
You know, this is kind of the basic nature of medicine. If you go into your doctor and you have pneumonia, we do not use one antibiotic for the next 100 people with pneumonia. That's just not the way medicine works. We look at the patient, we look at their age, we look at other illnesses that they have, look at other medications they might be on, and then you decide what you think is likely to work the best. And that's important in many illnesses, but pulmonary arterial hypertension, as Tarya said, is a fatal disease in many people. And if you don't treat them aggressively and well early, it's going to get worse.
So, Tarya, how does the federal government expect you to be treated now?
So I was fortunate in that when I was diagnosed, my doctor gave me two options. I could either try a combination of two different oral medications because I was too sick at that point to just try one at a time, or I could do an IV therapy in which I'd have to have a catheter put into my chest and IV drugs pumped in 24 hours a day for the rest of my life permanently. The catch was that the combination therapy, so the combination of two oral drugs, wasn't funded in BC at the time and still isn't at diagnosis. So I was fortunate enough to be qualified for a clinical trial that was looking at how effective it would be to try treating at diagnosis with two drugs at a time. And so I got onto that trial, and I was lucky enough to be assigned to the treatment arm of that trial, which means I got both drugs at once. And again, lucky enough that I responded very well to those drugs, because this is such an individualized disease. Not everyone responds the same way. And I was lucky enough that I responded very well. I've been able to return to full-time work. I'm a mother to an active 3-year-old little boy. I have certainly still challenges and limitations, but my treatment has allowed me to have something of a normal life.
Dr. Mehta, I'm listening to all of this and thinking, you know, from what you said, you don't treat everyone exactly the same way. Why do you think that the federal government has made this recommendation, and have they not listened? Is that where the problem is?
Well, that's part of the problem, and this is always a challenge. All of us recognize healthcare is expensive, especially new medications that are not used in many people. This is, again, a small illness, are even more expensive. So I don't know if your viewers have heard this. The average cost for some of these medications is $50,000 to $100,000 a year. And so very simply, the government looks at the cost of that, and they try to do an analysis looking at what benefit they're getting for that cost. And sometimes they don't do a good job of that. So they reached out a little bit to us physicians, and there's only a few of us in the country who look after this, perhaps 30 of us across the country in 15 centers, like in Vancouver. And they've talked to us, gotten some of our input, but we're very disappointed that the final report that came out in March didn't reflect what we had told them. That's the problem.
So what is your next step? What other what other repercussions can you take?
I think I could speak to that. I serve as an ambassador for the Pulmonary Hypertension Association of Canada. I work with the Patient Association on a volunteer basis, and part of what we're doing right now is reaching out to our government representatives, and we're making them aware of how serious an issue this is, of how serious a disease this is, because limiting the access to treatment when it is such an individualized disease could have very serious repercussions for patients, and we need to make the folks who are making those decisions aware that this is such a serious issue for us.
You've been working on this for a couple of months now. Do you feel that your concerns are being heard anywhere?
I do. I've been to see my MLA, Shane Simpson, and he was very supportive, and he sent me to see the opposition health critic, Judy Darcy, as well. I went to see them when the draft recommendations for this report came out, and now I've set up meetings to go and see them again now that the final recommendations have come out. And so I'm meeting with them next week, and I'm hoping that they will help me to bring this to the Minister of Health and to the folks who will be making the decisions regarding access to these treatments.
Well, please let us know how it goes.
I will.
We'd love to follow up with you.
Thank you.
Thank you very much for your time, Tarya.